Welcome everyone to the second episode of Humans for Care, Stories from Healthcare Leaders. In this series, we speak with healthcare leaders about AI and how it supports care quietly behind the scene so that humans can focus on what matters most, patients. Today, we're honored to be joined by Dr. Faizal Kassim, Chief Medical Officer and Director of Ultimed Healthcare Clinics. Dr. Faizal brings over 20 years of experience in Singapore's public and healthcare sectors, bringing a really rare perspective spanning frontline emergency medicine and large-scale primary care operations. In 2022, he was also awarded the PBM for his contributions to Singapore's COVID-19 responses. And today, he's really focused on building trusted, community-centered primary care at scale. Dr. Faizal, welcome to Humans for Care.
My pleasure.
Right. To start broadly, I really want to just quickly ask you, right, where do you see AI adding the most practical value in healthcare organizations that operates really across multiple sites? We're thinking about multiple units across the country, right, across different sectors as well, primary care, tertiary as well. Where do you see that adding the most value?
Well, I suppose to me, it depends on where this medical organization is currently at that time in terms of growth and operational complexity, right? So maybe an organization at the very beginning, when scale is not that huge, but yet there is presence in multiple locality, like you said, within the same country or across borders. I suppose there is a need to consolidate and centralize things like information dissemination, inquiry handling, even at the early stages. So, this will help the expanding or growing medical organization to not spend too much, especially for in terms of like a full-blown call center, right?
Definitely.
Things like that. And I suppose certain upstream inquiry, such as handling key business information when asked, appointment booking, centralized appointment booking will be most useful to remove this burden from our clinical staff so that they don't have to answer the phones that ring off the counter and focus on their daily jobs.
Right, I see that you put up a couple of teams involved, right? Leadership, of course, sitting where you are, is a lot about costing, efficiency, running of organization, clinicians as well, and frontline admin team. I'm just curious, who tends to feel the value first in your experience? Is it the clinicians, is it the leaders, or is it the frontline administrative teams?
I think, well, if you do it well, the most value probably was seen in the patient satisfaction, actually. Right? I think we just want to make sure that the patient feels attended to, they get what they want, the answers that they are looking for. And later on, the downstream effect will happen in terms of, having operational efficiency, the business, having more focused role, in terms of the ground staff and the doctors, then just doing what they're supposed to do and see the patients. So that will probably be a good start as an enabler.
Thanks for sharing. I want to switch the gear a little bit, right? How should really healthcare leaders think about AI when the challenge is scale and consistency? We've seen many deployments of AI gone sometimes horribly wrong, right? We've also seen it sometimes being constrained by operational teams and willingness as well. So how do you kind of balance that reality with AI being introduced in the market today?
Right. Well, from what I see, I mean, the effect and the potential benefits are probably seen in the larger businesses. I mean, not say that smaller businesses don't have much benefit, but I think when you talk about, large businesses, if you're not careful, there is always a higher likelihood that things are done in silos, right? A bit more fragmented, whether it's operations or finance or eventual outcome of the medical condition. So leaders will have to look at AI as an enabler, right? An overarching umbrella, or I think, forgive the term, connective tissue, which actually permeates the various aspects of the medical business, right? So, I mean, from appointment booking to medical notes writing to prescription handling, referrals. So that is how you can homogenize, standardize a large business and large operation to function in a consistent manner at scale.
There must be some time where you think that, hey, you know what, there is a problem out there and it's really underestimated by technology team. The technology team will come in and say, hey, this is easily fixable by tech, right? So in your experience, what operational or patient experience gap are often really underestimated by technology or technology team out there today?
Right. I would say that, I think in line with how the country or Singapore is heading towards, right? I think it's more a continuity of care for the benefit of the patient, whether you're going to see a private sector or public sector medical centers, right? So I think the important, this is a wish list hope that, that in terms of IT, having things vertically integrated, ensuring that there's a seamless patient journey, starting from their inquiries to the appointment booking, to the actual consultation itself, that leads to referrals, and then of course referrals leading to a specialist visit, and underpinning them are all issues about insurance coverage, employee benefits, and government programs. So in terms of tech, if there is an overarching connection that helps to provide a seamless journey for the patient, that's a gap that has to be solved, and it's going to be a win-win, right? It's all about patients, so that solution is to benefit them. But the so-called good side effect is that when you solve for this, your organization would also see probably more efficient handling of cases, less leakage of revenue, again, continuity of care to make sure that the clinical outcome is handled in a quality manner, negating the fact that there might be too many different ways of possible ways of an outcome that is not desirable. So that is probably the gap, to have a continuity and a vertically integrated solution in terms of tech.
Wow, that's really insightful. Now, moving from a broader perspective to your own organization, I would like to really love to hear about how these ideas have been applied at Ultimed, right? How has AI helped Ultimed create kind of like a more consistent experience across clinics? And like you mentioned, how to make it consistent and scalable without increasing the complexity of stuff. Were there anything you were worried about before rolling such a solution out?
Well, again, back to my point earlier. So it depends in terms of that organization, at what stage the organization is currently at. So for Ultimed, we are a new company. As you know, we opened our first clinic in April 2024, and now we're at 5 clinics. So very, very new greenfield clinics. So obviously, our priority is to to be able to channel all and direct leads to the correct avenues and location, right? So far, one of the AI function that we have leveraged on is a chatbot function. It standardizes how we handle response to inquiries from the public. It provides basic information and also, facilitate a lead generation and also appointment booking. The good side effect, and again, I mentioned before, is that our staff is able to function as a ground staff and not answering phone calls in the middle of work. That I've seen, that happens in other clinics that don't employ such solutions. So poor thing, the ground staff has to be a call center, has to attend to patients at the same time, which is not ideal. Another avenue that we are using AI is in terms of medical report generation for health screening. This is also not a new solution, not a new product, but it is a necessary function that a growing clinic needs to have. It reduces our turnaround time and maximizes the doctor's time to generate reports. It helps the doctor to provide concise, data-backed medical advice, and the doctor has always the final rights to tweak it to suit the actual clinical context. So these are at this moment for Ultimed the main two AI-driven initiative, and we're looking at more as the organization grow. There'll be more and more opportunities for other AI integration as well in other aspects.
Right, absolutely. Thanks for sharing that. I think one of the key things you mentioned was really about time saving and ensuring that the workforce could be really focused at what they are doing, right? I'm slightly curious, when you're rolling this out, I'm sure there were some concerns that you had, with AI solutions, whether it's the medical reports or the chatbot hallucination analysis or that. What surprised you most during the rollout? Like, how do you manage the risk, right? And how did it turn out in the end?
Yeah, so everybody is. I mean, when you talk about AI, I think the common worry is that are we being too reliant on the non-human assistance that may go wrong, right? So I think that's at the top of our head every time whenever we roll out any new initiative. So I think, like I mentioned, right? I mean, you still need to standardize things. You implement it upstream to ensure that there's efficient handling. And then when we generate leads from it, right? When appointments come in, there is that bolted on flexibility where in terms of operation, you can still make tweaks and amendments to an AI generated workflow, right? So we don't give it lock, stock, and barrel, relying on an AI workflow that helps us. There's always a need to balance it with a human oversight, right? A good example is maybe a health screening again. So you've got someone inquiring about health screening. You manage the inquiry very well with a chatbot. You get an appointment done. Now, so that's well and good, right? It saves the trouble in terms of manpower. But when the patient finally arrives in the clinic, there's always that human factor interaction with the doctor for the doctor to advise that maybe the whatever was recommended earlier was good, but maybe there's another recommendation that we want to do, we want to offer you. So there's that human element at the last point to make it more flexible and review. So similarly for health screening reports, right? A report is generated based on AI template, based on AI learning, but there's always a need for a doctor to sign off after he or she has read, amend and tweak some of the wordings to suit the clinical context. So, and also you have a base where it's standardized, and enhanced or rather enabled by AI, but you need to have the final outcome being vetted and reviewed. Now, I think this is a definite must in all operations.
See, so you're suggesting that AI really partners with human in the care journey, right? To ensure that the AI is there to support and not to lead the entire journey from front to end. Thank you so much, Dr. Faizal, for your openness and reflection today. It's really rare to hear such an honest view on what it takes to introduce AI at scale, not just the technology, but also the people, decisions, right? The things that you mentioned a lot is really about partnerships, right? It's not so much about, hey, just lock, stock, and barrel, the whole AI takes over the whole conversation, right? Thank you, Dr. Faizal. This concludes the second episode of Humans for Care, Stories from Healthcare Leaders. We hope this conversation strikes a balance, right? While we're thinking about AI and how that can enable scale and consistency. Care is ultimately still about people, patients, and staff alike. Right. Thank you so much for spending your time with us today. And if this resonated, please follow us along the conversation with the hashtag Humans for Care. Thank you so much, Dr. Faizal.
My pleasure. My pleasure. Thank you.